Design thinking is a structured, human-centered approach to problem solving that combines empathy, creativity, collaboration, and rationality. It's an iterative process that emphasizes understanding people first, generating bold ideas, and testing them rapidly to reduce risk and increase the likelihood of adoption. Design thinking is used to develop creative solutions, whether products, processes, or services that will actually be adopted by users, not just technically feasible. In healthcare, this approach ensures innovations align with patient realities, provider workflows, and system constraints rather than being solutions in search of a problem. Healthcare challenges are often called wicked problems. They are complex, ambiguous, and involve multiple stakeholders with competing priorities. Traditional top-down approaches may create solutions that don't work in practice. Think about new IT systems that technically function, but actually burden clinicians with more clicks and complexity. Design thinking shifts the focus to human experience, helping innovators uncover pain points that data alone may not reveal. For example, redesigning hospital discharge processes to reduce readmissions requires mapping the entire patient journey and uncovering anxiety points that patients experience but may not articulate in surveys. Design thinking follows 5 key steps developed by Stanford's T-School. Empathize, define, ideate, prototype, and test. These steps are not always linear. You might cycle back and forth between them as you learn and refine your understanding. Each step serves a specific purpose in moving from human insights to viable solutions, and each is critical for healthcare innovation success. Empathizing means deeply understanding the experiences, motivations, and struggles of patients, clinicians, and caregivers. Methods include ethnographic observation, shadowing in clinical environments, conducting patient interviews, and creating empathy maps to visualize user experiences. For example, observing nurses navigating electronic health record systems in real time revealed inefficiencies and workarounds that wouldn't be clear from system metrics or user surveys alone. The emphasis here is that empathy builds trust with stakeholders and uncovers real-world barriers that technical analysis might miss. The define step translates empathy findings into a clear, actionable problem statement. Avoid surface-level framing and dig into root causes. Ask why multiple times to get to the underlying issue. Instead of saying, patients miss follow-up appointments, reframe as, patients with chronic conditions need flexible, accessible scheduling options to effectively manage their ongoing care. Tools like how might we statements and root cause analysis help create problem statements that point towards solutions rather than just describing symptoms. Ideation encourages divergent thinking. Generate many solutions before narrowing down to the most promising ones. During brainstorming, defer judgment. Go for quantity and encourage wild ideas. The goal is creative volume first, evaluation second. Examples include brainstorming ways to reduce clinician burnout, considering apps, workflow changes, support groups, and even radical restructuring of care teams. Techniques like brainwriting and cross-disciplinary workshops bring diverse perspectives that can unlock breakthrough ideas. Brainwriting is a silent brainstorming technique where participants write down ideas individually before sharing them with the group. This prevents louder voices from dominating and ensures everyone contributes. Cross-disciplinary workshops bring together people from different backgrounds, like clinicians, engineers, patients, and administrators, to generate ideas that no single discipline might conceive alone. Prototyping means building quick, low-cost models to make ideas tangible and testable. The purpose is to reduce risk by testing assumptions early before investing significant resources in full development. Methods include storyboards, role-playing, mock-ups, and even paper prototypes. A low-fidelity prototype of a patient portal tested with seniors can reveal usability issues immediately. The key point is that prototypes spark conversation and reveal flows early when they're easy and inexpensive to fix. Testing means engaging users directly to gather real feedback on your prototypes and assumptions. For example, pilot testing a telemedicine workflow in one clinic before rolling out across the entire hospital network allows you to identify and fix problems at small scale. Testing is not the end. It's about learning, refining, and iterating. Each round of testing should inform the next iteration of your solution. Failure is reframed as critical input, not as a setback. Every failure teaches you something valuable about user needs and solution effectiveness. Remember these key takeaways. Design thinking is iterative, human-centered, and critical for healthcare innovation. It prevents the common mistake of building technically sophisticated solutions that no one will actually use. The core steps: empathize, define, ideate, prototype, test, provide a proven framework for moving from human insights to viable solutions systematically. Design thinking's distinctive value is bringing technical feasibility with human desirability. Many healthcare innovations fail because they're technically possible but don't fit into real workflows or user needs. In healthcare, design thinking creates solutions that are patient-centered, sustainable, and impactful because they are built on deep understanding of all stakeholders involved in the care ecosystem. Design thinking is essential for creating healthcare innovations that actually improve outcomes and get adopted in the complex realities of healthcare delivery.